Since June 11th, we have found a cluster infections starting from Xinfadi wholesale market, and also found the other cases in the different districts as well as in the other provinces. Therefore, that put Beijing in a critical situation, and because this is a really toughing war, so that require everyone to work together to fight against COVID-19. That is also a big test to Beijing. So we should not slacken off our efforts. It's a special time period which requires special measures. And also yesterday evening, we upgraded the emergency response level to the public health from level 3 to level 2. Beijing is a large city. There should be no off relaxation of our measures. So we should do everything we can to tighten our efforts to control the virus. And we do everything according to the level 2 requirements, and based on the plan set, we will implement all the measures and also to contain the spread of the virus, make sure that we will curb the spread of the virus. The Beijing citizens do not be panic, and also we should stay alert against the COVID-19 and also protect ourselves well. Wear mask in a scientific and correct manner. Keep your hand hygiene. Do not conduct mass gathering, and also always conduct ventilation and pay attention to food safety. Let's work together to win the war against COVID-19. Today we have invited our guests from the steering group and the group of quarantine and inspections, and the guests from the Bureau of Commerce, as well as our guests from the Beijing CDC, to give you more information regarding the current containment efforts. Now please allow me to introduce our guests. They are a member from the Beijing Epidemic Prevention and Control Steering Group, and also the Vice Head of the Organization Department of Beijing Municipal Committee, Mr. Wang Hongchun from Commerce Bureau of Beijing, Mr. Kuang Xu from the law enforcement team, and also Madame Peng Xinhuo from Beijing CDC. Now first, allow me to give the floor to Deputy Director of the Deputy Head of the Organization Department of Beijing Municipal Committee, Zhang Qiang, to introduce the results of the PCR test. Friends from the media, good afternoon. Since June 11, Beijing has keeping reporting the cluster infections, focusing on Xinfadi wholesale market. This is a sudden outbreak, catching everyone in surprise, and also put a threat to the economic and social development of Beijing. We should do everything to resolutely cut off the transmission and curb the spread of the virus, and we should also conduct everything in a scientific and also the precise manner, and we should also put the epidemic prevention and control as the top priority and the most urgent job for the city. In order to do so, and make sure that we can implement the plans made by the Beijing municipal government, and also with the top priority, we conducted a nucleic acid test. Starting from the 13th of June, we have conducted an AT test to the people working for the wholesale market of Xinfadi and surrounding compound residents, as well as people had a travel history to Xinfadi market, as well as the employees. For the other farmer market, in total, 356,000 people have received their PCR test. And today we will also receive the results of the 355,000 results of the PCR test results of people working for the all markets. And here I would like to share with you the information of your key concerns. First, regarding people that should be tested, they will already get it tested. For people in Xinfadi market, which is the epicenter, and also people living in the medium and high risk areas, the medical practitioners, the frontline responders, the already back to school students, and also the school staffs, the faculties. In total, 6 groups of people that will have already been tested as required in their jurisdiction. So please follow the requirement of your jurisdiction and also receive the NAT test. And we will also enlarge the group of tests. If the result is negative, we will also give the result back to the person. If the result is positive, then we will base on the epidemiological investigation to conduct the transfer job. And for the people that are willing to get a NAT, they can make an appointment and go to the designated institution, or they book appointment in their community. So far, we have released a list of institutions for NAT, so do not go to the fever clinic without appointment. Do not conduct a public gathering, and also avoid of a cross-infection. If you show the symptoms such as fever, coughing, or throat sore, please go to the fever clinic. Every day, we collect a sample totaling 400,000 per day. We will also enlarge this number in the coming days, and we will mobilize all the resources. In total, 98 institutions will help us to do the NAT, make sure we provide the service, as well as conduct a very smooth and efficient testing work. For all the residents in Beijing, please cooperate with the staff in this regard, and let's work together to win the war against COVID-19. We should not make this hard-won achievement in vain, and let's work together to protect Beijing as well as protect our people's safety and health. Thank you, Mr. Zhang Qiang. Now I would like to give the floor to Wang Hongcun from the Beijing Commerce Bureau regarding the daily necessity supply guarantee. Friends from the media, good afternoon. I would like to give you the following up information regarding the market supply as well as price stability. First, we intensify our efforts to conduct the epidemic prevention and control to the catering sector. Yesterday evening, Beijing already upgraded its public emergency response level to level 2. Therefore, we stick to the most stringent measures. Therefore, we have done the following. First, we let the people involved in this regard to practice everything, follow the level 2 requirements, and also they also should have the plan in accordance in place to implement the measures. And we also stop the wedding banquet and also the other gathering parties. For the offline fairs or the other offline activities all suspended. And we also should contain the traffic of the commercial areas, and also we should take people's temperatures and also to check their health codes and also register their information and also conduct regular ventilation of each place, and also implement the 4 early measures. Make sure that the people in the post, they should be in healthy condition. If people have had history to Xinfadi wholesale market, they should receive a PCR. And we also work with a targeted group of people as well as the place, including a farm market, the supermarket, the vegetable and the fruit stores, to let them understand the roles and responsibilities as well as how to manage the people have had been to the Xinfadi wholesale market. Make sure everyone know their responsibilities and implement the measures. And third, regarding the supply of the fruits and vegetables, so far they are well guaranteed. We look at the stores in the communities as well as large supermarkets. Right now we find less phenomenon of a shortage of daily necessities. And for the secondary market, we also have the hotline 12345 and also the other apps to help us to monitor the real situation. 37 stores had a temporary shortage. And on the 14th, we had 31 stores, and 15th, 27, 16, we have 6 stores that encountered a shortage of daily supplies. Therefore, the large-scale supermarket also invested more the headcounts, investment, and other resources to allocate or purchase more daily necessities and also transfer them to Beijing in order to increase the supply of the daily necessities. So the larger scale ones to help the smaller ones to work together to replenish the supply, and also we have a third party to provide a supply and transportation to 59 stores. Jinkelong also made their announcement and also a commitment to the public that the 10 items of vegetables that will not change the price. They will do everything to maintain the stable of the price as well as the supply. Hema, the online platform, also extend their working hours. And the Jinkelong, Wumei, and in total 8 supermarket, 92 stores involved. They increased the number of the supplies to 2,961 tons, which is 71.3% more than the number on the 11th. And they also sold 2,361 tons, which is doubled their original sales. So going forward, we'll make sure a stable supply of the daily necessities and make sure there's no shortage happened at the retail end. Thank you, Mr. Wang Hongcun. Now I would like to give the floor to Mr. Kuang Xu from the Market Supervision Bureau regarding the work in the catering sector as well as the market operators. Since the cluster infections happened in Xinfadi wholesale market, based on the working arrangement made by the Beijing Municipality, and we put a really close eye on the illegal behaviors regarding the price gouging or the food safety as well as the product quality. We will take the most stringent measures to protect the order of Beijing and make sure people can set assure to consume, purchase all these daily necessities. And yesterday, Beijing also raised to level 2 regarding public health emergency response. Therefore, the market supervision teams also conducted our inspections, especially covering the farm markets, the supermarkets, the restaurants. And we also focus on the meat, pork the poultry, masks, protective suits, as well as the fresh frozen pork, beef, mutton, aquatic products. We will focus on any illegal behaviors in this regard, and we'll also look at their inventory and also look at the traceability of all these products to look at whether they have a reliable origin of all these products. For the price gouging, especially for the daily necessities or PPE, that is also under our focus. And for the restaurants, if they consume or purchase the illegal meat or other products with unknown origin, that is also in our key focus. And for the market, if their environment actually is not really clean or they did not conduct the irregular disinfectant, they will also be penalized. So far, we have assigned 6,500 personnel conduct the inspection. That we focus on the 4,300 markets, 4,623 restaurants, 1,568 supermarkets, and also 5 cold chain stores. So in the recent time period, we also put a very close eye on price fluctuation. That is also actually concerns everyone. So I will also hereby give you more information in this regard. So our focus actually is on the wholesale market, the supermarket, as well as the farms market in the communities that are covering the wholesale and retail end. And we also roll out a larger scale of inspection. And we also give the on-site guidance as well as penalties. On one hand, we punish hard to the illegal behaviors, and on the other hand, we also encourage the business owners to practice abide by the laws and the regulations, because we are the gatekeeper of our people's daily necessities. We send 6,170 personnel. So far, we penalized 7 cases. On the other hand, we also look at the public exposure or the complaint of the complex fluctuation. So far, we received 78 hotline complaints, and we checked case by case, and we clear all these cases, make sure everything we receive from the public, we deal with it seriously. Price, especially the price of vegetables, always top of our agenda. We do everything to guarantee a stable price as well as safety and health of our people. Thank you, Mr. Kuang Xu. Now I would like to give the floor to Madame Peng Xinhuo, Deputy Director of Beijing CDC, to give you the updated information regarding newly infections. Friends from the media, good afternoon. Now I would like to give the information of the newly confirmed cases on June 16th, as well as the recent analysis of the new infections. From 0 o'clock to 24 o'clock yesterday, the newly confirmed COVID-19 cases, 31, 19 male cases, 12 female cases, average age 43 years old, the youngest 8, the elderly one 70, 6 with permanent Beijing residents, 25 with non-permanent Beijing residents, 19 Fengtai, 5 in Daxing, 3 in Dongcheng, 3 in Haidian, and 1 in Xicheng district. By clinical classification, 10 mild, 20 normal, one severe symptoms. All these are highly relevant to Xinfadi wholesale market. We look at the current situation of epidemic in Beijing. Based on the epidemiological history as well as the result from the laboratory as well as the preliminary screening of people as well as environment. Right now, the epidemic still happened around the Xinfadi wholesale market. Based on the 137 cases, the majority of which actually were the people work for Xinfadi or the buyers from Xinfadi. So Fengtai, especially Huaxiang, actually are the high-risk region. And the environment with a positive result of COVID-19 actually is the trading hall. So this means that maybe the infections caused by the human-to-human transmission and contaminated objects. So far, the majority of the infections are actually the mild or normal symptoms, taking up 95% of the total newly infections. Because all these related to the Xinfadi wholesale market, based on the curve of epidemiology, we can say that we found the cases at a very early stage. Right now, the pandemic is still on the rise because Xinfadi market is the largest place for daily necessities, featuring large migrant population. It's really hard to control, so we may see a rise of confirmed infections in the coming days. Second, on June 16th, Beijing raised the public health emergency response level from 3 to 2. The people working for Xinfadi, they should not leave Beijing. And for the other residents, if it's not necessary, also please stay in Beijing. So this is a very critical time, so please protect yourself well and also meet the requirements of epidemic prevention and control. So the parties, public gatherings are all these encouraged. And also please keep social distancing at least 1 meter. And also that we should take the people's temperatures and also the register with the entrance guards, check the health code before entering the gates, and also to scan the code and also take their information registration. Keep your hand hygiene, wear a mask in the correct manner, and also the people working in the service sector, they should wear masks. For the very close distance contacting, less than 1 meter, if it happened in the close or the poor ventilation areas, you should put your mask on. If you showed symptoms such as coughing, fever, sore throat, please pay a visit to the hospital as soon as possible and also tell the doctor regarding your contact history. Please conduct for the public areas. Please conduct the ventilation as frequently and also make disinfectants. Thank you, Madam Pang Xinhuo. Now the floor is open. Please identify yourself before raising the question. Any questions? With Beijing Daily, my question to Madame Pang. Beijing right now upgrade the response level, how the individual can protect themselves well. Thank you for your question. Since June 16, Beijing has raised the public health emergency response level to level 2, which means everyone first should follow the guidance or orders of your community. If you had been to Xinfadi market, we encourage you to stay at home and also report to the community and also receive the NAT. And also should also follow the practice of a temperature taking, the registration with the entrance guard, and also check the house codes. And also please always keep your hand hygiene and also wear masks. And if you think you may contact the contaminated objects, please wash your hands or use the sanitizer. And also avoid touching your nose, mouth, and please cover your mouth when sneezing. And also for the plum, and also should use a tissue to cover them and throw out the garbage bin. If you paid a visit to the hospital or visit someone in hospital, or you show the symptoms, or if you take a public transportation, or you're in a place with poor ventilation, or you had a very close distance contact, please wear your mask. And also please do not do public gathering and avoid to go to the places with a high population density. And if you take an elevator or waiting in the line or join a public event, please make sure you keep social distancing.
好，谢谢。下面请继续提问。好，中区第4排右数第一位记者。
BTV. A question also goes to Madam Pang. So for the public, how do they understand who should be the close contacts? And for the people in the medium high risk regions, they should be all received nucleic acid tests. Thank you for your question. Based on the requirements from the central government as well as the Beijing Municipality, we talk about close contacts, which means that the 4 days before the confirmed or suspected cases showed symptoms, as well as asymptomatic carriers, they had a close contact with less than 1 meter, such as they live together, work together, study together, or visit someone hospitalized, or they had a close contact with medics, or you take a public transportation with someone confirmed or suspected cases. Anyone who had a travel history with Xinfadi or contact someone with the Xinfadi history, they should receive the nucleic acid test. For the all compound, right now all practice the close-off management. For the key groups of people or key areas, everyone should receive a PCR. They should follow their local requirements. For someone without a close contact with someone with the Xinfadi travel history or a confirmed or suspected cases, do not need to panic. Please stay at home or monitor yourself. If you not really show any symptoms, you do not need to receive a nucleic acid test in the hospital in order to avoid cross-infection. That's the end of the QA. And the Beijing Epidemic Prevention and Control Press Conference is a press conference right now taking place twice per day, and is also available in different media platforms, and also available in the radios as well as TV channels And you can always stay tuned with CGTN. We will always bring you the live coverage of the presser of Beijing Epidemic Prevention Control Presser. So you can check the updated information with CGTN New Media. Thank you all the guests and friends from the media. Thank you all. That's the end of today's presser. Thank you.